Well, Obamacare enrolments are happening right now. And one thing everyone's aware of is...
Our premiums skyrocketing.
Well, a little dramatic, but yes, Attack Ad, they are skyrocketing. But why is that? Well, the first thing is that private health insurance overheads cost over $100 billion a year, and it's going up. About a quarter of that is profit, and then there's a big slab for administration and marketing. And what's the solution for that?
Medicare for all.
Well, maybe. Private health insurance overheads do cost 7 times as much as Medicare overheads do, which might be why American health administration costs are double the global average. So Medicare for all would save tens of billions of dollars of administration costs. Unfortunately, that's not where the money is. Like, for instance, the cost of doctors is over $600 billion a year. In the 1980s, an American doctor on salary typically earned about 20% more per hour than other American professionals with comparable levels of education. Today, that's become nearly 50% more than other American professionals with comparable education. In fact, according to McKinsey, if US doctors simply earned the same amount as doctors in other advanced countries do, America's doctor bill would be roughly 35% lower. That's over $200 billion less a year. So, who wants to be the first politician to cut the wages of the doctors that 65% of Americans love to pieces? Bearing in mind, this is what Americans think of politicians. And the real big money isn't even there. It's here, in hospital stays. We're talking over $1 trillion a year. And according to one study, the average hospital visit costs nearly 3 times more in America than the average for other advanced countries. But why do doctors and hospitals cost so much? Maybe a clue lies in this 2013 survey of advanced countries. America had half as many primary care physicians per capita than the next closest country, and 1/5 the number of physicians as in France or Germany. So, not a lot of competition going on there. In fact, 39% of American metropolitan areas have highly concentrated markets for primary care doctors, with 65% of metropolitan areas being highly concentrated for specialists. And as for hospitals, 90% of metropolitan areas lack competition for them. And it's getting worse. Just the first 6 months of this year saw 58 major mergers amongst hospitals and healthcare systems. To put all that in context, by the way, if you stay in a hospital that faces no competition, your bill will be $1,900 higher on average than if you stay in a hospital facing 4 or more competitors. So that is a big reason why healthcare is so expensive. And Bernie can have Medicare for as many people as he likes, but unless he can find a way to beat the $512 million per year in health sector lobbying and $260 million per election in donations, and unless he can somehow break up some hospital monopolies, then Medicare for all will end up as cheap as the government paying defence money to monopolies, where they spend $30 million on forest camouflage for Afghanistan. Oh well, at least it'll give us something to talk about for the next few years.
Nice!
Woo! That's what it's all about.